How is lymph node TB treated today? Have you ever wondered how lymph node tuberculosis is treated? Lymph node tuberculosis is a form of extrapulmonary tuberculosis that specifically affects the lymph nodes. The treatment for this condition is primarily based on standard anti-tuberculosis drug regimens, similar to those used for pulmonary tuberculosis. The main goal is to completely eliminate the bacteria and prevent resistance. For drug-susceptible lymph node tuberculosis, the typical treatment lasts between 4 to 6 months. It usually starts with an intensive phase of 2 months where different antibiotics are used. These antibiotics include isoniazid, rifampin, pyrazinamide, and ethambutol. After this initial phase, the treatment continues for an additional 2 to 4 months with just isoniazid and rifampin. Recent updates to treatment guidelines have even allowed for shorter durations in certain cases, which is a positive development. Now, if the tuberculosis is drug-resistant, such as rifampin-resistant or multi-drug-resistant tuberculosis, the treatment approach changes. In these cases, newer all-oral regimens are used, lasting about 6 months. These regimens may include combinations of drugs like bedaquiline, pretomanid, linezolid, and sometimes moxifloxacin. This shift to newer treatments has improved adherence and outcomes, moving away from older regimens that could last 15 months or more. In some instances, additional procedures may be necessary. For example, if there are abscesses or significant enlargement of the lymph nodes causing symptoms, surgical drainage or excision of the affected lymph nodes may be considered. However, surgery is not the first line of treatment and is only performed when specific clinical indications arise. Throughout the treatment process, careful monitoring is essential. This helps to assess how well the treatment is working, manage any side effects, and ensure that patients stick to their medication regimen. Directly observed therapy or integrated case management is often used to support patients in completing their therapy. In summary, lymph node tuberculosis is treated with established anti-tuberculosis drug regimens tailored to the type of drug susceptibility. The treatment usually lasts 4 to 6 months for drug-susceptible cases, while drug-resistant cases may require newer, shorter all-oral regimens. Clinical monitoring and, when necessary, surgical intervention are also important components of managing this condition. Always consult healthcare professionals for personalized medical advice to ensure the best outcomes.